Ever wondered why tuberculosis, an ancient disease, still poses a significant global health challenge? Welcome to our deep dive into the world of tuberculosis, often simply referred to as TB. This is a disease that has been around for millennia, leaving its mark on human history. It's a story that has spanned from the pharaohs of Egypt through the Middle Ages up to the present day. Tuberculosis is a bacterial infection, primarily affecting the lungs, though it can spread to other parts of the body. It's caused by a clever and stubborn bacterium known as Mycobacterium tuberculosis. This little bugger has evolved over time to become a formidable foe, capable of surviving and thriving within our bodies. Historically, tuberculosis has been a significant cause of death worldwide. It was known as the White Plague in Europe during the 18th and 19th centuries, and its impact has not waned much since. In fact, despite advances in medical science, tuberculosis remains a major global health issue today. You might be wondering, why is tuberculosis still a problem in the modern age? Well, it's a complex issue. Tuberculosis is a master of adaptation and survival. It's resistant to many antibiotics, making it difficult to treat. It's also highly infectious, spreading easily from person to person through the air. Moreover, the surge of TB cases in recent decades is often linked to the HIV epidemic. People with HIV are more susceptible to TB due to their weakened immune systems. Additionally, factors such as poverty, malnutrition, and lack of access to quality healthcare contribute to the persistence of this disease. Understanding tuberculosis is crucial, especially for those in the medical field. It's not just about treating the disease, but also about understanding its social, economic, and political implications. It's about recognizing the barriers to effective control and eradication, and working towards solutions. So as we embark on this journey, we'll explore the causes, symptoms, diagnosis, treatment, and pathology of tuberculosis. We'll delve into the science, but also the human stories behind this enduring disease, and we'll try to answer that burning question. Why, in an era of modern medicine, does tuberculosis continue to be such a significant health challenge? So let's dive deeper and unwrap the mystery of tuberculosis together. What causes tuberculosis? Why is it still prevalent in many parts of the world? Let's dive right in. At the root of tuberculosis, or TB, is a crafty bacterium known as Mycobacterium tuberculosis. This tiny, rod-shaped microorganism is the ultimate culprit, causing havoc in the lungs and sometimes other parts of the body too. But how exactly does it get there? Imagine someone with active TB coughing, sneezing, talking, or even singing. Each of these actions releases tiny droplets into the air. Within these droplets, thousands of Mycobacterium tuberculosis are suspended, ready to find a new host. If you breathe in this contaminated air, the bacteria can enter your lungs and set up shop. It's as simple as that. This is why TB often spreads among people who spend a lot of time together, like family members or co-workers. But don't panic just yet. Not everyone who inhales the bacteria falls ill. In fact, most people's immune systems can successfully wall off the bacteria, keeping them dormant. This is what we call latent TB. It's a sort of stalemate between your body and the bacteria, with neither side gaining the upper hand. However, the bacteria are not eliminated, and they can become active years later if your immune system weakens. So what factors might tip this delicate balance and increase the risk of infection? A weakened immune system is a major one, often due to factors like HIV, malnutrition, or certain medications. Age is another factor, with young children and the elderly being more susceptible. And let's not forget about substance abuse, tobacco use, and certain medical conditions like diabetes, which can also increase your risk. Lastly, where you live and work can play a part too. People in crowded places or in countries with limited access to medical care are more likely to contract TB, and that's why it's still prevalent in many parts of the world. Understanding the causes helps us better strategize prevention and control measures. So now that we've covered the causes, let's move on to the symptoms. Stay tuned. Now that we know the causes, what are the signs that someone might have tuberculosis? Tuberculosis, often known as TB, manifests itself in a range of symptoms. Some are quite common, like a persistent cough that lasts for 3 weeks or more. This cough might be accompanied by chest pain and coughing up blood or sputum, which is mucus from deep inside the lungs. Another common symptom is unintentional weight loss. You might find yourself shedding pounds without any changes to your diet or exercise routine. This can be a result of your body working overtime to fight off the disease. Then there are the night sweats. Imagine waking up drenched, even though the room is cool. It's not just a little perspiration. We're talking about soaking your bed sheets, Not a pleasant experience, to say the least. Fatigue is another symptom of tuberculosis. It's not just feeling tired after a long day, it's a deep-seated exhaustion that doesn't go away with rest. You might find that you're constantly low on energy, struggling to get through the day. Now it's important to distinguish between latent and active tuberculosis symptoms. With latent TB, you have the bacteria in your body, but your immune system is keeping it in check. So you won't show any symptoms and you're not contagious. However, the bacteria can become active if your immune system weakens, leading to active TB. This is when you'll start noticing the symptoms we've been discussing. And remember, not everyone who has TB will exhibit all these symptoms. Some people might only have a few, or they might have different symptoms altogether. The key is to listen to your body and seek medical attention if something doesn't feel right. Recognizing these symptoms early can make a significant difference in the treatment and control of tuberculosis. So stay informed and stay vigilant. Your health is in your hands. What tools do doctors use to confirm if someone has tuberculosis? If you've ever wondered about this, you're in the right place. Let's delve into the world of tuberculosis diagnosis. To start off, one of the most common methods used is the tuberculin skin test, also known as the Mantoux test. In this test, a small amount of a substance called PPD tuberculin is injected just below the skin of your forearm. If you have been exposed to the bacteria causing tuberculosis, your skin will react with a firm red bump at the injection site within 48 to 72 hours. It's a quick and relatively simple test, but it's not definitive. It can sometimes give false positives, especially in those who have had the BCG vaccination. This is where blood tests come in. They can provide a more accurate diagnosis. These tests measure your immune system's reaction to Mycobacterium tuberculosis, the bacteria that cause tuberculosis. They're especially useful if you're at high risk of TB and have a negative skin test result, or if you've recently received the BCG vaccine. But even these tests aren't foolproof. So, doctors often turn to imaging tests, such as chest X-rays or a CT scan. These can show white spots where your immune system has walled off TB bacteria, or they can reveal changes in your lungs caused by active tuberculosis. Finally, for a conclusive diagnosis, doctors might use microbiological tests. These involve taking a sample of your sputum, the mucus that comes up when you cough, and checking it for TB bacteria. This test can take a few weeks because the bacteria grow slowly, but it offers the most definitive proof of active tuberculosis. The importance of accurate diagnosis in tuberculosis management cannot be overstated. It is the key to starting the right treatment and preventing the spread of this potentially deadly disease. With these tools, doctors can detect tuberculosis and start treatment as early as possible. So, next time you hear about tuberculosis diagnosis, you'll know exactly what's involved. How can tuberculosis be treated? Is there a cure? Good questions, and the answer is a resounding yes. Tuberculosis, often known as TB, is indeed a treatable and curable disease. The primary treatment for TB is a standard 6-month course of 4 antimicrobial drugs. These drugs are isoniazid, rifampin, pyrazinamide, and ethambutol. The initial phase of treatment lasts 2 months and involves all 4 drugs. The continuation phase lasts 4 months and typically involves just isoniazid and rifampin. It's important to understand that TB is a tricky adversary. The bacteria that cause TB can become resistant to the effects of these drugs, making them ineffective. This is what's known as drug-resistant TB, a challenge that healthcare professionals around the world are grappling with. There are 2 types of drug-resistant TB, multi-drug-resistant TB, or MDR-TB, and extensively drug-resistant TB, or XDR-TB. MDR-TB is resistant to the 2 most potent TB drugs, isoniazid and rifampin. XDR-TB is resistant to isoniazid and rifampin, as well as any fluoroquinolone drug and at least one of the 3 injectable second-line drugs. Treating these types of TB is more complex, requiring longer treatment times with drugs that are less effective and have more side effects. Now you might be wondering, how can we prevent drug-resistant TB? The answer lies in adherence. Adherence to the treatment regimen is of the utmost importance. The drugs must be taken exactly as prescribed by the healthcare provider for the full duration of the treatment. Failure to do so can lead to drug resistance, treatment failure, and the continued spread of TB. So, while it's true that TB treatment can be a lengthy process, and at times challenging, it's crucial to remember that it's a lifesaver. It stops the disease from progressing, prevents the spread of TB to others, and eventually cures the patient. Though treatment can be long and challenging, it's crucial in saving lives and preventing the spread of the disease. What exactly happens in the body when the tuberculosis bacterium invades? Well, let's dive right into it. Tuberculosis, often shortened to TB, is caused by the bacterium Mycobacterium tuberculosis. When this bacterium enters the body, typically through inhalation, it travels to the lungs, where the drama unfolds. Here, our immune system jumps into action. White blood cells, the body's defenders, attempt to attack and destroy the bacteria. But these bacteria are quite the tricksters. They can survive inside these cells, using them as a shield and a home. This is where the term latent TB comes from. The bacteria are present, but they're not causing any symptoms. They're just biding their time. The next act in our drama is the formation of granulomas. This is the body's way of trying to contain the bacteria and prevent them from spreading. These granulomas are like tiny prisons, made up of immune cells, which encapsulate the bacteria. However, it's within these granulomas that the TB bacteria can persist in a dormant state for years. That's right, years. They're simply waiting for an opportunity to strike, often when the immune system is weakened, and that's when latent TB can become active TB. When TB becomes active, the granulomas can break down, releasing the bacteria and allowing them to spread to other parts of the body. This can cause a variety of symptoms, and if not treated, can be fatal. But here's the fascinating part. The immune response, while trying to protect us, can sometimes contribute to the disease progression. The formation of granulomas and the inflammation they cause can lead to tissue damage, and this can result in the classic symptoms of TB, like coughing and chest pain. So you see, the pathology of tuberculosis is a complex interplay between the invading bacteria and the body's own immune response. It's a dramatic story of invasion, survival, and sometimes destruction. Understanding the pathology of tuberculosis not only fascinates us, but also guides us in developing better treatments. So, we've taken a journey through the world of tuberculosis. What have we learned? We've discovered that tuberculosis, often shortened to TB, is a potentially dangerous infectious disease caused by bacteria known as Mycobacterium tuberculosis. The disease primarily affects the lungs but can also spread to other parts of the body. We've identified the main symptoms to look out for: persistent cough, fever, night sweats, and weight loss. We've also delved into the process of diagnosing tuberculosis, highlighting the role of skin tests, blood tests, and imaging studies. We've explored the various treatment options, noting that while TB can be deadly, it is also curable and preventable. Lastly, we've examined the pathology of tuberculosis, learning how the bacteria invade and damage the lungs. This knowledge is invaluable in the field of medicine, helping us understand, prevent, and treat this disease. With this knowledge, we are better equipped to fight tuberculosis and work towards a healthier world.